Hello, sawubona mbukeli sikwamukele kuhlelo lethu lanamhlanje ilungelo lakho. It's your right. Sindethela lona la kumahamba phambili SABC 1 eMzansi for sure. Alternatively SABC Plus if wena you're smart enough to have downloaded the app. Uhleli noMajali uMangcolo singuNhlanhla ngo-Alicia. Those are all my names. Mbukeli ubugebengu kuma medical aid scheme kushiya enkulu imbobo emaphaketheni ethu njengoba singabathengi. Kodwa ke ngabe lokhu kwenzeka kanjani phela kukhona abagade lezinto. Asingabe sakhuluma kakhulu singene shiqe udaba into namhlanje. Asizwe kabanzi-ke ngevakashi zethu namhlanje mbukela ukuthi zisixwayisa kanjani phela nokusetshenziswa phela kwama-medical aid schemes enu. Asamukela izivakashi zethu namhlanje. We do have uDr. Toko Potelwa obuya eCouncil for Medical Schemes. Sibe naye ubaba uDr. Stan Moloabi omeleke yena i-Government Employees Medical Scheme phecelezi i-GEMS. Ladies and gentlemen, a great afternoon. Thank you so much for joining us. Welcome to the show. Siqale ngawe Dr. Potelwa. Kunjani?
Thank you for having me.
Thank you so much.
We are fine.
We are fine.
Yes, well.
All right. Dr. Stan? Sekwamukela baba njani?
Sikhona njani?
Ay siyaphila kakhulu. So maybe let's just basically get an understanding. Dr. Potelwa, xa sithatha nge medical fraud, medical aid scheme fraud, what exactly are we referring to?
Sithatha ngesenzo esi-intentional by both member service providers, could be administrators or MCOs, where members want to receive payments or certain benefits that they are not entitled to. So that affects medical schemes. Kufuneka zibe processes and systems in place to prevent fraud eyenziwa ngabantu. And it does not only apply to members. There is most times a collusion between members, doctors, other service providers within the healthcare sector, like pharmacists,
third parties
that get involved in this. And some of this information that talks to fraud, we don't even get involved in, because you have members that complain, and after they've complained to the doctor, if it's the doctor that has done this, the doctor will collude with the member to say, okay, I've already deducted this money,
that amount,
so let's just sit on it, I will pay you back the money. So some of these things we don't see.
But Njani doctor, because I mean, as the council, aren't you the overall mother body? Aren't you the regulator?
Some of the functions are not within each jurisdiction here, CMS.
Okay.
So where there are complaints, as is the SWACO CMS, we work with the schemes, we work with the service providers, we collate the information. So kulonyaka we've created what we call a foreign fraud, waste and abuse charter. This whole summit was started in 2019, but due to COVID and other things that happened after COVID, there has been a delay in implementing, but we've just signed the fraud, waste and abuse charter. And it includes all the stakeholders, especially the stakeholders that we regulate.
All right.
Brokers, schemes, managed healthcare companies, and administrators. When I talk about managed healthcare organizations, those are the organizations that actually are contracted by the schemes to manage their accounts and systems and billing and everything.
Okay.
The administrators as well.
Okay.
Then we've also brought in the other regulators, the associations of all the service providers. It might be HPCSA, SANAC, where it's nurses, pharmacists. We also have brought in other...
Doctor, I want to hold it right there because Dr. Stan, okay, you're talking about all these regulatory bodies, but I'm actually asking myself, but how many people are aware that there's so many places where they can actually direct inquiries, regulatory bodies? Dr. Stan, I mean, how prevalent is ilokuzana in medical fraud, particularly amongst our members when Lapagui James?
Yeah, thank you, Alicia. The short answer is that it's very prevalent, and then the extent to which it's prevalent is the biggest question. So we, at the moment, we use estimates of what we think could be fraudulent, waste and abuse in terms of claims against medical scheme. So we don't have research that has been conducted in South Africa. So we are using estimates that are used globally. So globally, it is estimated that third-party fraud where healthcare funding is involved is about 20%.
Okay.
And that's very significant.
It is. It's absolutely significant. And to break it down even further, I mean, it's about 25 billion rand per year that is actually lost to Inansiga medical aid schemes up in South Africa alone.
Absolutely.
So those are huge numbers.
It is huge numbers. And, you know, while we're using estimates, we're saying 20%, and you have estimated about 25. Actually, it could be more. Let me just demonstrate. We think it could be 20%. So what we have done, we said, let us not overestimate. It could be anything between 5 and 20%. So we take the middle road, we say 10%.
Okay.
So when you look at claims paid just by the private industry, it's in the region, it's in excess of 280 billion rands. Jeez. So if you take that middle road, you're talking about 28 billion rand, which is closer to that 25%. Just in the GEMS environment, we paid in the past year claims to the value of 58 billion. So that could be 5.8 billion if you're taking the 10%.
Doctor, it says it's 15% of claims are paid by the medical aid. So they are actually at the shorter end of the spectrum there and actually have to try and gather this revenue, which is why we end up having to pay higher premiums. But let's leave it there for now. I want to quickly take an ad break. Mbukele mengibuya lapho ke uyazi njengenjalo ke ngizovula ingcingo la studio. Nisishayele nisibuze imibuzo noma nibeke imbono. We're back shortly after this. Don't go anywhere. Welcome back to Yilungelo Lakho live here on Mahamba Phambili SABC 1 Mzansi for sure. Namhlanje Mbukeli uma wena you've just arrived ekhaya sixoxa phela ngalento abayibiza i-medical aid scheme fraud lapho uzothola ukuthi mhlambe imember noma odokotela noma kusetshenziswana konke nje kuba igroup bathatha imali kodwa kuclaimelwe izinto ezingakaze zenzeke lapha ya bese ke kufiwa kanjani between mina nawe esikhokha ama premiums ayanyuka ama premiums because imali silahlekile. My guest today, I do have the lovely Dr. Toko Potelwa ovela kwi-Council for Medical Schemes alongside Dr. Stan Moloabi ovela lapha ya eGEMS. Mbukeli bazama ke ukuthi basicacise ukuthi nina ke ningazivikela kanjani kulobu bukhwabanisi. Ungashaya ke inamba la e-studio 0117140662, alternatively 7140663. Those are the magic numbers uma ke wena mhlambe uke waba nenkinga noma khona ofuna ukubamba impimpa because nansi i-Council for Medical Schemes ungabaceba namhlanje. All right, so Dr. Potelwa, maybe let's go back to you in terms of also mhlambe ungasinikeza modus operandi yokuthi labantu what are the most commonly used tricks abawasebenzisayo. I mean, we've heard about laba, for example, corny cases that were actually quite prevalent in a year whereby abantu bazohamba bayofuna ama doctors absenteeism letter or i-sick note babuye baze lokhuzeni baze emsebenzini bazoyisubmita or aclaim umuntu ukuthi kadenza a certain procedure emsebenzini and then they come back umuntu akazange azayenze leyo procedure. Usinikeze eminye imizekelo.
Thank you. Imizekelo common, it's when people share medical aid. ndithatha i-medical aid yam, ndiyiboleke usister wam who's admitted to hospital. Okay. Sometimes it can have dire consequences because if that person passes away whilst in hospital, then it creates a fraud more, and a scheme has the option yokuku suspender, yokuku blacklista, so that ungaphinde uthathwe nayiphi medical aid.
Doctor, because wonke umuntu ophethe i-medical aid card ine details zakhe, uadmitwa njani esibhedlela nge-details zomnye umuntu?
People share their IDs and a medical aid.
And all these healthcare professionals do not see that?
It happens. It happens.
Oh, wow.
And then, it's important to buy members zizijonge statements zaso. Uba ubuyile kwagqirha, it's important that you see that the doctor has charged for the services that they have provided. So if fraud iba khona apho where doctors see the member, they will charge for that consultation. After a month, they will charge for another consultation. There's also other forms of fraud where a member would go to the doctor and ask for the script, and the script is not used for the purpose eyo. Ufumanisa ba umuntu uyothenga perfume, uyothenga ukutya komntana, uyothenga ezinye izinto that are not healthcare related. There's AMC pots, there's shoes.
I'm shocked.
There's other stuff that medical aid is used as a credit card instead of being a medical aid.
Can you help us there, Dr. Stan?
Yeah, actually,
our point, yes, and then now it's
identity theft, yes. Because we have recently had an incident in Free State that actually is exactly what she was referring to. So a mother had a child who was very sick. And then this mother abangabalisa this other child here. So only one dependent ku medical aid.
Okay.
But this dependent ubaliswe ku medical aid
is not the
one that's sick.
Okay.
And then because touch and go, in the hospital, they don't always ask for everything. And in this instance, it's a child.
And also it's an emergency,
and
doctor,
it was an emergency, yes. And then they admitted this child who is not on the medical aid.
Okay.
And this child passed away. It's a James case. I can mention it. We're not going to say the names of it.
Yes, let's
but it was in the news.
Okay.
And this child passed away, and it exposed the very same identity fraud. So it actually is very serious linked to fraud. The other cases where you find that members bakoludale the doctors. Sometimes they are in financial distress. They hear about this doctor where you go, you say, doctor, I need money. And then I will give you my card. You claim from my card, and then you give me the money that I need. So if I need 500 rands, but the doctor claims 1,000, and then he makes a profit. These cases are there, and cases where there is collusion between the doctor and the members. We then also have the other type of fraud where you find that practice are registered. So you have a practice is registered, but the people who are submitting claims are not actually practicing. So what they do is they've registered under Dr. Stan Moloabi, the practice number and everything.
Okay.
And then because it is and this is why there is fraud in the industry. It's called third-party claiming.
Okay.
So then they claim as if when you got services from this practice, but there were no services. There is collusion again. They submitted claim. We don't know. We pay. Only when we look at the trends, this claiming trends, they are not okay, then we will stop and do investigations. So that is really the reason why there is fraud. It's this third-party opportunity which is there. It's unlike when you go into a supermarket, you want a loaf of bread. You go in, you pick up the bread, you pay.
Yes.
And then that's it. With medical aid, medical insurance, the opportunity is brought about the fact that we are blind to what service has been rendered.
But how is this, though, Dr. Potelwa? Because I suppose there needs to be a regulatory body that actually does some sort of quality assurance before the approval of such claims.
Okay, I've already mentioned that schemes contract with managed healthcare companies and administrators.
So you're saying it's out of your hands, basically?
It's not completely out of our hands, because when there are complaints, then we work with the schemes.
And there's no way of picking this while it's still happening in the system along the supply chain before it actually goes to finance, I suppose, for payout?
Yes, it can be picked up by schemes. Proactively, schemes within the systems, they have rules in the system. So when, for instance, uzawuya esibhedlela, your doctor will give you a pre-authorization form to say you are going for this condition. These are the codes that will be claimed. So in such instances, you can easily pick up whether the doctor has upcoded and added extra codes to charge more.
Okay.
And then that can be corrected. But in the case of
But those are rare cases of vigilance, doctor, because it seems like this thing is just going ahead unabated.
Yes, but other types of fraud sometimes are difficult to pick up. So you pick up the trend, then you continue to update your system and putting more rules on the system to proactively
and they
pick
still
up this.
bypass them.
It's trends
they
that
find
you
new
pick
ways
up.
to bypass them. My goodness. So, Dr. Stan, tell me, have you ever had a case whereby individuals that, let's say members in your regard, were actually not even aware that the information was actually being used, and they ended up having to actually pay the bulk of the monies that have been paid out in terms of claims?
Yes, well, it does happen.
But how does the member then prove that they were not part and parcel of the fraud?
Only after investigation. So
all right, hold that thought,
yes.
Doctor, because I want to quickly pay my bills. Mbukeli, it's getting really, really hot here. Ngicela unisfonele la e-studio because niyeza ukuthi ngeke lokukhwabanisa ngathi kuningi kakhulu, and ngathi bayazi labantu ukuthi ama loopholes akuphi. That is why beqhubeka besebenza. We're back shortly after this. Don't go anywhere. Mbukeli, lines are wide open. 0117140662, alternatively 7140663. Sikhuluma la Mbukeli namhlanje nge-medical aid scheme fraud. Lapho ke uthatha ama-details wakho wena noma aware or ukuthatha ama-details wakho by the third party ukuthi benze sure ukuthi bazoclaima imali lapha kwi-medical aid yakho. Uzozwa wena ususele necala ungazi nokuthi i-medical aid yakho ibisetshenziswa fraudulently. My guest today, Dr. Toko Potelwa, the Council for Medical Schemes, alongside Dr. Moloabi ovela lapha ya EGEMS. Let's go to the lines quickly. Sikhulume nensizwa uBhunkululeko all the way in Rustenburg. Bhunkululeko, samkwamukela insizwa ohlelweni. Umbuzo noma umbona?
Sisi mina nginenkinga ngajoyina i-medical.
Yebo baba.
Last year ngaNovember yaqala kudonsa la kimi ngoJanuary. Mara emakhadi ale medical abanginiki. Nangiya kubo ngibafonela kule nombolo banginika yona bangithuka la efonini.
How?
Ngahamba ngaya mina mathupha officeini yakhona bangitshela ukuthi le medical leyo ke ithengisele enye ikhampani. Mara imali yami ngiyadonsela 1700.
Aw.
And 60 bani ngenyanga. Sengidonsele 4 months. Ngiyagula namanje ngesifo senhlitiyo yami kuthiwa ivebuhlungu. So ngihamba kulomnye udokotela special ngiyabhadala. Mara ngidonsela imali kuphela kwenyanga.
Okay, and then uke wakhona ukubatrayisa labantu Bhunkululeko ukuthi mebekutshela labo ukuthi badayiselwe ikhampani kuthiwa bayaphi laba babenikeze ischeme?
Lo sisi langimthwale kulelo office unginika inombolo, inombolo nangifonela ikhale pali.
How? Okay.
Ayibanjwa ngumuntu.
All right, uke wazama Bhunkululeko ukuthi uyireport le ndaba kuma authorities noma uhleli nje kanjalo?
Mina ngireporte emayini ngisho ngifuna ukuthi ngikhansele medical because ingimoshela imali ngalapha ngidosela imali ngalapha ngiyalaphisa mina self
Okay, bathini kumu complaina kwi council yelokhuzana yabemithi baba?
Ikhambane ithi yona ngeyikhona ukuthi cancel medical ndayicancela ngaNovember.
So abakhoni ngisho ukuthi bakhanselise lokhuzana even though bathi the company went under was sold. Okay, Nkululeko siyabonga kakhulu. Who wants to assist here? Dr. Stan?
Yeah. I'm sure even Dr. Potelwa will assist.
Okay, yes, please.
Yeah, the way ngizwa ngakhona Nkululeko ngathi uyasebenza and then bamdonsela. Yes. Bamdonsela, despite the fact that now they're saying a company, the one he was contributing to, Iseko.
Yes.
But they are continuing ukudonsa. So under these circumstances, the way we asked Uti Kiwa reporter somewhere, he says he tried. The first port of call, Ula Mabasevenza Kona.
Okay.
That's where you would start and say, hey, I'm no more working, or why are you still drawing Imaliam, whereas I'm still not a member, I can't use the medical scheme.
He was given a number,
well, that is a problem. So the next thing then, we know Uti, I'm a members with my medical aid. We're going to take him as a member because he's still Basam Donsel. Yeah, so the next port of call is to complain to the Council for Medical Schemes. The Council for Medical Schemes, it takes care of the complaints to members. And where do we get the numbers? Usually you then go to the website, because the number I told you actually on the poll. So you try and get from a website to Council for Medical Scheme, where do you complain? And unless maybe there's also a help from Dr. Potelwa, that would be the next port of call.
Okay, Doctor?
Thank you. Email yethu for complaints. It's complaints@medicalschemes.co.za. E-members must also be able to differentiate between an insurance product that was sold to them versus medical aid. Some people batenga medical aid, yet it's an insurance product.
Okay.
So Uputi must actually, unfortunately, we can't mention names at TV, but he needs to know the name of the scheme so that we'll be able to trace whether it's an insurance product or it's a medical scheme. Okay. So if it's an insurance product, it doesn't fall under the umbrella, CMS. We'll be able to send or assist him to send the complaint yake to the relevant authorities, which is IFISCA, because insurance products are managed by IFISCA. But if it's a medical aid, maybe that has merged with another medical aid, then we'll be able to assist him and trace.
And this is exactly my quagmire, Doctor, because shouldn't there be some sort of collaboration with the company, especially if Mamejile, and so as to communicate to your members to say, listen, we're going to continue deducting, in this case, usa deductelo. So the only place that he knows to go and complain to is that old place. So they should have at least some sort of information ukuthi uzo-assisteka kanjani.
Yes, normally there's two ways to join a medical aid. It might ingaba iqalwe through the employer,
yes,
or
individually.
Uzenzela ngokwakho.
Yes.
But ubhuti uthetha ngoba usebenza mine.
Yes.
So if ibiqalwe yi-employer, the employer must be able to assist him in tracing
exactly
which company did he join if it was initiated by the employer.
This is frustrating. This is really frustrating. All right, so let's talk about amalokuzana, ama cases, amanye are prevalent. We're speaking here about e-collusion. I want us to focus on corruption here, doctors, because very recently, I mean, towards the end of last year, there was a huge case also in the news whereby lawyers, abetata bantwana guma villages, abantwana mostly suffered from cerebral palsy, abazali bebengaziswa nokuthi basayniswani. These lawyers went and claimed kwi department abakhokhelwa imali, of which these people had never even seen Lama lawyers except on the day that they'd actually come there seeking information yabo to use for these claims. So let's talk about how do you then usizakala kanjani lapho if you are caught in the middle of that, and what are some of the consequences as well, Dr. Stan, if ukufumanyeka ukuthi people are really colluding with third parties like your lawyers as well as other service providers?
Yeah, and the word third party, it's the main thing.
Yes, absolutely.
So what happens, Kohore, the opportunity to it's a fraud. It creates this thing of, I am a member, a fund.
Okay.
So we were mentioning the one where the lawyers, usually it's RAF, it's been in the news.
Yes, we've seen with RAF
it's been
well.
in the news.
Yes.
So it's a third party, Leon is a third party claim. So what happens is that these people did not know. So the ones who have children who are said to be having cerebral palsy, the ones who family members were involved in accident. They didn't know what they can claim against a fund, and it's a third-party fund. So suddenly there are these lawyers who are unscrupulous.
The vultures should
be
called.
They look for the people where there is information that either a child may have been had.
Where do they find these medical records, doctor? Because obviously to have access to this group and amalokozana, contact details of these claimants, you need to have had a list somewhere from a medical practitioner.
It has been very complex. Some of them, it's people, they've got what we call people, about the touters, yes, that's the term I was looking for.
So there's people scouting for them, really?
There are people who come up, who look for the information. You were involved in an accident, you didn't know, you just get, let's say you had a medical aid. You
Dr.
get discharged.
Stan, you're frustrating me. Please hold that thought, because I need you to go into greater lengths in explaining this after this short break. And of course, Goodman, please stay on the line. We acknowledge you there from Ekariecha. We're going to be speaking to you shortly after this break. Bugale 01171406662, alternatively 01171406663. Ungasjoina futhi lapha on our social media platforms. Sikhuluma namhlanje ke medical aid scheme fraud. My guest today, Dr. Toko Potelwa from the Council of for Medical Schemes South Africa, alongside with Dr. Stan Moloabi ovela lapha ya eGEMS. Let's quickly go to the lines before nginikeza Dr. Stan ithuba ukuthi aqhubeke naleya explanation yakhe, because I'm really interested ukuthi how is so much fraud being let go. Like akekho umuntu engathi uactive ukuthi amise le fraud. But Goodman, Ekariecha sekwamkela baba. Thank you so much for staying on the line. How can we assist you today?
Hello, ma'am. Ma'am, I have this problem.
What happened, sir?
My medical aid is deducting currently 7,000 odd.
Okay.
And now I got some statements from this company that is taking blood. And it's not just that one. There are more of them, and some of them are threatening me to put me on this red flag. Whilst my medical aid is deducting each and every month. Now my concern is, or my question is, why can my medical aid cover all those costs? Because I have the right to do so.
Okay, and if you're asking your medical aid, but Goodman, what are they saying? What answers are they giving you?
They don't give me. Even today, I did send them the statement, and they say they're going to call me back, but they didn't do that.
Okay.
There by HR at work, they sent me to their offices at PE, but I didn't go there because they are the ones who must proceed and do all the processes for my medical aid to make sure that everything is covered, because they are deducting 7,000 and odd each and every month. That is too much.
All right, Goodman, thank you so much. And we'd also like to suggest sharing your number with our guest today, the good doctor, so that they can try and assist you should we not be able to assist you right here on air. Thank you so much, Goodman. Dr. Steve?
Yes, and I'm going to have Dr. Toko also assist me.
Okay.
So it sounds from Mr. Goodman that these are the laboratory type of claims.
Yes.
Now, can I just state that it's a very common thing?
Yes.
That you see a medical aid, and I suspect that could be the case, in early categories of benefits.
Yes.
So you have benefits for going to your general practitioner.
Dentist.
Yes, a dentist.
Optometrist,
exactly.
whatnot,
So
not for open heart surgery.
Exactly. So then those have got limits. So sometimes what happens is that you find that a limit is used many times. Maybe you will go to the doctor, they draw blood many times, and then the benefit gets exhausted. When that happens, the company that basically gave you the service will then say, well, we claim for the medical aid, it pays us 750, but your overall was supposed to be 1,000. Exactly. The shortfall must come from you. So what do you do in those circumstances? You have to ask the medical aid and say, medical aid, I am receiving these accounts. Why are they asking me to pay, whereas I am paying every month? So it is the medical aid is the one which is supposed to explain to you why is it that they only paid 650 and why are they not paying the balance. Some medical aids will then even assist you with what is called ex gratia. Ex gratia is basically when a medical aid says, oh, okay, because you are very sickly, your benefits got exhausted, please apply for grace. And then they assist you with the one that, so some medical aids do that. It's not all of them though.
And Dr. Potelwa, but this is the issue though, because I mean, a 7,000 rand deduction and there's no transparency here. And utata uyagula, usoloke agula, but he's not getting any explanation. How do you then work around this? How do we assist Utata Goodman?
Within the organization, ECMS, we have an education and training unit that focuses on ensuring that members understand their rights and also their liabilities. What I can pick up is there's bloods that were not paid. Sometimes you do get the doctors, especially the pathologists, that do not write the proper codes. Normally we use codes to identify the diseases.
Yes.
So they normally use what is called Z codes instead of using the actual diagnosis. So that disadvantages the member. You go, you have the bloods taken, everything is Z code.
But why isn't there a general rule for everybody, doctor? It seems like everybody is working in silos and creating their own policies. I suppose, well, we can expect this going from government to private sector, but I suppose there should be a general health practitioner's rule that this is how you actually claim and write your codes.
The rule is there that everybody must use the normal ICD-10 codes.
So what's
the challenge is sometimes when you go to a hospital, we don't know the diagnosis. Then once the bloods have been taken, then there's a diagnosis. Then you can link that diagnosis to those bloods. So sometimes members, when they take those accounts back, the scheme is able to look at what has been claimed, what was the diagnosis, and that will most probably be covered because they can see that those bloods were linked to that consultation.
Okay.
But a lot of members do not know or are not well educated about such. All they get is the account, the orange envelope that says we want our money, the scheme has not paid. So members must go back to the scheme to say, I've got this. The scheme will be able to trace it back to what was the diagnosis, because earlier on you were still trying to eliminate a diagnosis ukuthi indoni ngela xesha lokuqala member ebiyobonwa ngugqirha. Then once the diagnosis is made, you link those bloods to the diagnosis.
But doctor, surely don't you think it's all these missteps in between and shorter and longer steps in between that are actually the loopholes, creating the loopholes where people can actually commit this medical fraud? But hold that thought. I want to go back to the lines there and take usisithandi la eSoweto. Sisithandi, sakwamukela Ntokazi ohlelweni. Umbuzo noma umbona namhlanje?
Kunjani sisi?
Ngiyaphila Ntokazi wena?
Ngiyaphila sisi Alicia, ngibingelela nabodokotela lapha e-studio.
Bayakuzwa odokotela Ntokazi.
Lalela ke Mbokodo, nginenkinga lana ngisuspecta yona le medical aid fraud, right? By profession I'm an educator, right? So I had a medical aid and it was my first time using it, right? I got admitted to the hospital, everything was fine, I got discharged. After some 2 months, 3 months, now I'm receiving SMSs saying I'm owing some company laboratories an amount of about 2,900. Now I'm asking why, because I have a medical aid and my medical aid covered all my charges. Mm-hmm. Now they're saying to me, no, my scheme did not cover that, I need to pay that.
Okay. All right. And
yes.
if ukhuluma neskimi sakho Sisithandi bathini bona bakuchazela kanjani?
No, they're just telling me, you know, you have to pay it because your scheme did not cover that. No, but you guys, how about you contact those people? But Bonavana authority contact. Then Minamanga contact my medical scheme. They're saying to me, no, ma'am, all the fees were covered. We don't know why those people are calling you.
Hayibo. Okay, Sisithandi siyakuzwa ke Ntokazi umbuzo wakho. This is a quagmire though, because it sounds like somebody's trying to push an agenda ukuthi collect ama fees. Lento kade sikhuluma ngayo doctors of umuntu ukuthi uzoklemela for services that were not even rendered. But how do then ama members make the council or any other authorities aware of such behavior?
No, the way to go, it's your medical aid. Because as a member on a contract, a medical aid, you are paying every month, and then you live under the promise
that they're settling all my bills.
Yes, that they are settling. And if they don't, that's the first port of call. Go to your medical aid and say, but why didn't you pay? I'm paying you every month. Why don't you pay?
They're sending these patients from pillar to post, doctor, and that is my concern.
Yes.
And these are people that have been sick, and most of them, they're not even mobile.
Yeah, no, I agree. That can be a problem, and I'm hoping that the member will be able to get to follow up on this 2,000 rand. I heard her say she's an educator.
Yes.
So it means probably she's
you guys.
Yes. So
I was actually about to say
that's right. That's basically we need to find a way of, even though the others who phoned earlier, you can share the numbers with us. If we find that they are not our members, we'll be able to direct them somewhere. We'll be very, very happy to help them that way.
Thank you, doctor. Yes. It takes us ukuthi silayithe indaba before izinto zimuva. We're back shortly after this break. Ungayindawo. Bogale, welcome back. Sisadingida udaba lethu ke namhlanje lama medical aid scheme fraud inamba zami la e-studio 01171406662, alternatively 01171406663. My guest, Dr. Toko Potelwa, Council of Medical Schemes, alongside Dr. Stan Moloabi ovela lapha ya eGem. So Dr. Potelwa, you heard the previous caller as well. Is there any input ongathi ungayisiza ngako? And also just maybe in general, when a member is suspicious of fraudulent activity or the activity angayibonisisi kahle mayelana nama statements awa receive pertaining to medical aid yakhe, what can they do, especially if they're going to medical aid basende from pillar to post and they're not giving them the relevant answers?
Okay, thank you. Ndizaqala ndithethe taking it from the last caller,
yes,
and then coming to this caller. Members also, it is important that they must understand what is called prescribed minimum benefit. On a yearly basis, medical scheme sends out a brochure or a booklet that explains what will be covered in full and what will not be covered in full by a medical aid. And there's a list of conditions that are listed there, which are chronic conditions. Then there are other 271 conditions where it tells you for diagnosis, medical management, or surgical management. So members must acquaint themselves with ezincwadi, bafunde, bayazi, understand what it is that they are covered for. Secondly, where a member...
Because service provider, the onus is on you. This is what you are going to pay for. If you're going to be taking a premium exclusions, because not everybody can understand.
Okay. In medical schemes, they do communicate this information to members. Unfortunately, a lot of members might not have access to email.
Okay.
For instance, if you look at those prescribed minimum benefits, the option that a member chooses, because in medical aid has different options,
yes,
and e-options is the amount that one can afford.
Yes.
So e-option may be a slightly cheaper, might have certain limitation, choose ababini. Unless you are out of the area yakole or kuyo, then you can use that other doctor.
Is that not in the fine print though, doctor? Because
no, it's communicated.
Okay.
Then secondly, the scheme communicates what we call designated service providers.
True.
Which is, these are the hospitals that you can use.
Yeah, nama chemist
that
yes,
you can use, or they actually arrange for a member to get, they actually arrange a member uba ipilisi zayo or treatment yayo isiwe to the member ekhaya okanye emsebenzini. So members that adhere to the rules of the schemes as per the option umuntu ayichuzileyo rarely get to pay a co-payment. So it's important for members uba zizi-educate ngezo zinto.
Okay, all right. And Dr. Stan, maybe just in closing, I mean, advice to your members, in particular, those that that also have some everyday queries.
Yeah, I think the important thing, it's for our members to try as best as possible with bafunde all the communication by Tola from medical schemes.
Oh, Koko benze kanjani but Stan? Okay, what if they misinterpret the information because that's medical jargon.
Yeah, that's exactly where we're going then. What's the next option if they cannot read the communication?
Yes.
The next option is that medical aids banally numbers where all queries are referred, and we really want our medical scheme members to always use those numbers, including when they don't get joy, call the medical aid, to have the one-star cancel for medical scheme because it's there to protect their interests.
Doctors, unfortunately, we're out of time, but thank you for indulging us. Insightful information today. Thank you so much to Dr. Toko Potelwa from the Council for Medical Schemes, alongside Dr. Stan Moloabi there, Ovela James Mbugeli. They were our guests. Namhlanje ke besiza ukuthi sisize wena ukuthi phela ube wash out ukuthi kwenzakalani lapha kwi medical aid yakho. And also now don't just pay ilokhuzana premium kwilokhuzana installment ye medical aid. Ungazi ukuthi ivalele ini uzozo the day usugula when you need to be airlifted to a hospital we couldn't even remove you from a scene of a car accident. So bantu bakithi ngicela ningaxabani nezincwadi fundani lapha. Yakajali intokazi ethi nithanda nonke emakhaya sale kahle. Awela kumnamam